The days of limited access to quality medications and healthcare services are long gone, with Innovarx Global Health ushering in a new era of healthcare delivery in Africa. IGH now offers an all-inclusive care plan designed to provide a comprehensive management of chronic diseases, such as diabetes, hypertension, and other ailments that require close monitoring and routine medications. Our global clinical team leverages technologies such as point-of-care diagnostics, telemedicine, Agasta cloud-based electronic health record system, and electronic prescription processing of FDA-approved medications to effectively manage patients and produce positive health outcomes. The plan provides a peace of mind to patients in the Gambia and their loved ones who may sponsor from overseas by providing 4 free prescription medications a month, 4 diagnostic tests a year, free wellness on wheels delivery from Banjul to Basse, 10% off all products and services, all for a price less than a cup of coffee a day. D $38,050 a year. Flexible payment options available. Why travel abroad to receive quality healthcare anymore when IGH can bring the quality you deserve to your doorsteps? Sign up today by calling 220-232-4224 or emailing careplans@innovarxglobal.com.
Thank you, viewers. Once again, welcome to Dialogue with the Youth, so on Gunjur Online TV. Today, our program on Wednesday, 9th of June 2021. The time in the United Kingdom is about 7 o'clock. The time in the Gambia is about 6 o'clock. And Eastern time is about 2 o'clock. Today, we have a very important guest, one of our illustrious sons of the Gambia, who leverage tech-enabled platforms using the best virtual health care that our country mostly need, especially this time of our developments. Not only that, this virtual tech health care platform is tapping into the energy and giving you peace of mind, especially those who are in the diaspora, wishing for perfect health for their people back home. In essence, these illustrious sons of the Gambia is democratizing health and dismantling boundaries between North and South. Viewers, I will introduce you to this special person of our country, Dr. Ismail Badjie. Welcome, Dr. Badjie, to Dialogue with the Youth, so on Gunjur Online TV.
Thank you very much, Thank you very much, Ebrima, for welcoming me. It's truly an honor to join your platform. To all your viewers, hello from the Gambia. Just looking forward to a great conversation, but it's truly an honor to be invited onto the platform for a conversation. So looking forward to the conversation.
Thank you so much, Doctor. We are most honored, to have you, and we will celebrate you. We are really, really proud of you as a young Gambian, who is, in this position and giving back to our country, an area that the country needs desperately, because we are saving lives. Thank you, Doctor, once again. Doctor, after welcoming you anyway, what we are going to do now, you have to tell us who Dr. Ismail Badjie is, where you started, your education, and whatever you can bring just to tell the Gambians who you are. Welcome, Dr. Ismail, and go ahead.
No, thank you very much. Truly a pleasure. So as you mentioned, Ismail Badjie. Are you able to hear me just well?
Yeah, we're hearing you now. Yes, Yes, go ahead. We are hearing you now.
I think I'm having a little bit of challenge.
Yes, Doctor, I can hear you now.
Ebrima, are you able to hear me well?
Yes, I'm hearing you now. You broke before, but it's okay. I can hear you, doctor. Yes, I can hear you. Are you hearing me?
Hello?
I can hear you perfectly well, doctor.
Can you hear me, Ebrima?
Yes, I can. I can hear you.
Okay, excellent. Thank you very much. I was having a hard time hearing you, but nonetheless, like you mentioned, my name is Ismail Badjie. I was actually born in Banjul, the capital city, but left Banjul quite when I was younger, actually, because of the nature of my dad's job at the time as an ambassador. So I actually spent the first couple of years, early years of my childhood, briefly in Brussels, Belgium. And then my family transitioned to New York. So I was actually in New York till the early 90s when my family moved back to Gambia. And I could say from the early 90s till primary school, middle school, high school, lived a very typical life of somebody going to school in the Gambia. Did my schooling, primary schooling and middle schooling at Ndaus Comprehensive, Mrs. Ndaus, and kind of thing. And then transitioned to the public school, went to Gambia High School, where I was a science student at Gambia High School from 2000 till 2003 when I graduated as well. Left Gambia when I was 17, back to the US, where I've been up until my return home. Proud son of two amazing parents who I wouldn't be who I am, where I am without them. That being Dembo Badjie and Harindong of Banjul as well too. And also come from a very supportive family of five, from older brothers Malik, older sister Fatim, younger siblings Aisatu and Ebrima. So yeah, I think the best way to describe my life is I've lived and experienced life both in the Gambia with a lot of rich experiences, a lot of good relationships, but also life in the United States as well too, which has been home for a significant amount of my adult life, including schooling. Did my undergraduate studies at Tennessee State, where I received a bachelor's in chemistry. And then decided to advance and go get a doctor of pharmacy at Purdue University in Indiana. And so for the early time of my career, I was actually working as a community pharmacist, but had always had keen interest in leadership, community health care delivery. So yeah, I think in a nutshell, that's a 2-minute version of who I am.
Thank you, doctor. In an essence, ecosystem of different discipline within pharmacies. I think nuclear pharmacies also is there, and management and leadership is key here. And I think we are lacking that a lot in the Gambia, leadership in different areas. And doctor, tell us about Innovarx Global Health. What inspires you to start IGH? And tell us what products and service does IGH provides. In essence, how does it work? Just give us a gist, for people who are in England here in Europe who want, to know more about IGH. What inspires you to start it? What products and service does you provide? And how does it work generally? We can hear you, doctor. Can you hear us, doctor? Go ahead.
Are you able to hear me?
Yes, I can hear you very well.
For some reason, I am not able to hear you.
Okay, we can hear you clearly. Can you hear us?
All right. Can you hear me?
Yes, I can hear you. We can.
Huh.
The days of limited access to quality medications and healthcare services are long gone, with Innovarx Global Health ushering in a new era of healthcare delivery in Africa. IGH now offers an all-inclusive care plan designed to provide a comprehensive management of chronic diseases, such as diabetes, hypertension, and other ailments that require close monitoring and routine medications. Our global clinical team leverages technologies such as point-of-care diagnostics, telemedicine, against the cloud-based electronic health record system and electronic prescription processing of FDA-approved medications to effectively manage patients and produce positive health outcomes. The plan provides a peace of mind to patients in the Gambia and their loved ones who may sponsor from overseas by providing 4 free prescription medications a month, 4 diagnostic tests a year, free Wellness on Wheels delivery from Banjul to Basse, 10% off all products and services, all for a price less than a cup of coffee a day. D, $38,050 a year. Flexible payment options available. Why travel abroad to receive quality healthcare anymore when IGH can bring the quality you deserve to your doorsteps? Sign up today by calling 220-232-4224 or emailing careplans@innovarxglobal.com.
Hello, doctor. Can you hear us? Hello?
All right. Ebrima, can you hear me?
Yes, I can hear you very well, doctor. I can hear you. Can you hear me?
The days of limited access to quality medications and healthcare services are long gone, with Innovarx Global Health ushering in a new era of healthcare delivery in Africa. IGH now offers an all-inclusive care plan designed to provide a comprehensive management of chronic diseases, such as diabetes, hypertension, and other ailments that require close monitoring and routine medications. Our global clinical team leverages technologies such as point-of-care diagnostics, telemedicine, against the cloud-based electronic health record system and electronic prescription processing of FDA-approved medications to effectively manage patients and produce positive health outcomes. The plan provides a peace of mind to patients in the Gambia and their loved ones who may sponsor from overseas by providing 4 free prescription medications a month, 4 diagnostic tests a year, free Wellness on Wheels delivery from Banjul to Basse, 10% off all products and services, all for a price less than a cup of coffee a day. D, $38,050 a year. Flexible payment options available. Why travel abroad to receive quality healthcare IGH can bring the quality you deserve to your doorsteps. Sign up today by calling 220-232-4224 or emailing careplans@innovarxglobal.com.
Hi, doc. Can you hear us now? Dr. Badjie, can you hear me now?
It is. I can not hear you guys. Let me see here.
I can hear you very clearly.
I could hear the video when you're playing it. For some reason, I cannot hear you.
Wow.
Let me, apologies real quick. Let me just look into something here. Can you hear me?
Hello, doctor. Can you hear me now?
Yes, I can hear you perfectly.
Oh, fantastic! Really fantastic. This does happen sometimes anyway. Doctor, we will start it where we are. I think
Yes.
you have to tell us, who Dr. Ismail Badjie is, for our some of our listeners who are joining now, and we can start everything first. Hopefully, this time around it will go smoothly, as we expect.
Yeah, absolutely. We're all at the mercy of technology sometimes. But once again, pleasure. So Ismail Badjie, I was born in Banjul, actually, in the capital city. So I still proudly consider myself a Banjulian, even though I don't remember anything about Banjul from my childhood, because we left when I was younger due to the nature of my dad's job being in the diplomatic service. Dembo Badjie is my dad. So we left in my early childhood, lived in Belgium for a couple of years and moved to New York. Upstate New York, where we were till early 90s is we actually returned back home to Gambia. And I say that because most of the times, early 90s is when I started knowing what being Gambian, living in the Gambia was all about when we moved back early 90s. And I think from that point, I had a very typical childhood. I did my schooling, primary school, middle school at Ndaus Comprehensive, Mrs. Ndaus, and then transitioned into the public school system at Gambia High School, where I was a science student, was head boy at Gambia High in 2003. So completed high school and then returned back to the US when I was 17. And I've been there since. So my life definitely has been spent on both ends, but still obviously, as you know, you could take the boy out of Gambia, but you could never take the Gambian out of the boy. So obviously Gambia has always been home, even with living in the US with schooling. So I did my undergraduate studies in the US at Tennessee State, where I did a bachelor's in chemistry and then transitioned into professional school, where I did my Doctor of Pharmacy at Purdue University in Indiana. So for the most part of my professional career in the US, I was working in community pharmacy, leadership, community leadership as well too. That was always curious. I've just been linked to healthcare delivery in communities. And I think that's kind of influenced even what I do now. Work for Walgreens in the North Carolina area, manage a lot of Walgreens 24-hour stores, did specialties in nuclear pharmacy, medication therapy management, HIV management. So just a lot of good experiences very early in my career as a pharmacist that gave me just opportunities to be where I am today. So in a nutshell, come from a very supportive family too. My dad's originally from Bansang. My mom is a Banjulian. So very supportive family that I hold there.
Thank you, Doctor. I will call you Dr. Sumaila now because that's a typical. That is a typical Gambian way of calling Ismaila, Sumaila. So I don't. I'll call you Dr. Sumaila now. That's our Gambian way. We don't have to Arab Easternize this. We have to Gambianize your name, and I will call you Dr. Sumaila here time to time. Once again, I'm welcoming all our listeners from all over the world. Today is a pride moment for Gambia as we have our best brains here who not only confine their education to only certificates, but practically they impact on our community back home in myriads of ways. As we all know, we are starving. We are starving as a country from a healthcare system perspective because the dire and the lack of support and funding in our health sector and delivery of healthcare in the Gambia is causing life. So if we have a young man who was highly educated, but not confined to that, he is bridging, democratizing and smashing barriers between the North and the South and bringing America in the Gambia, in the street of Gambia to save lives. That should be a pride moment to all of us. And we have our one of the CEOs of EPPIS charity, Fatutal or Chekti, and Kadi Jaban, all are saying hi to you, Doctor. I know Hadi Kulubali is part of your team, but anyway, Hali, good to see you here watching. Jeff Manka says, yes, you are both audible. My own brother, Alasan Scattred Janneh, says, last week, I went to his store to get a cough medication in the Gambia. Fantastic, brother. And Hadi Modunjai also saying hello, assalamu alaikum to all of you. Please share this program because this is fantastic. We need to not only celebrate our people, but we need to support them because if this business succeed, maybe we will have one of the. I know, doctor. At the first glance, you're not thinking of building a structure and all those things. As you claim in one of your interviews. But anyway, as the business progresses, anything can happen. Doctor, tell us about the IGH, Innovarx Global Health. What inspires you to start IGH? What products and service does you provide? And in essence, how does it work? Tell us, give us the genesis, give us how things are so that the common people from Fatoto, Gunjur is not that remote anyway, or anywhere in the Gambia can understand what is going on so that they can benefit from these fantastic initiatives of yours. Go ahead.
No, thank you very much. So I always like to start by putting a disclaimer that I did not grow up in a household that I had an influence of anything medical around me. My dad was not in the medical field. My mom has been an entrepreneur, a second generation entrepreneur. So if anything, I grew up in a household of business and diplomacy and career civil service in my dad, but I'm the only family member who went into the medical field. So I never had a dream of becoming anything in the medical field growing up until I got to science school, realized that, science came very easy to me. But I started getting more curious. And Innovarx has a personal story because as I mentioned, I moved back to Gambia in early 90s. So I did not get a chance to know my grandmother, Aja Fatim Menga of Afdai. She died when she was 56 years old from diabetes and hypertension. I did not get to know my grandfather, Manka Badjie of Bansang, by the way of Wiam. And it dawned on me in my early adult years that my story was not unique. If you peel the layers of what's happening in our communities, our elders are not living long enough to get to know their grandchildren. And I was not unique to this situation because my grandmother, like many adults, 56 years old, somebody dying from diabetes and hypertension only happens in areas like the Gambia or sub-Saharan Africa where access to basic preventative care or continuity of care does not exist. So I always like to think that she inspired what Innovarx has become because I figured the reason why the average Gambian only lives to be about 60 years old, if you peel the layers of that, access to basic healthcare is at the root of it. So as I started practicing in the United States, I noticed a few things. I did a lot of work in rural America, meaning parts of America where it's not the city. They have the same challenges. Not a lot of doctors live in the area, not a lot of pharmacists, not a lot of nurses. There's poverty. So it's always good to paint the context that a lot of the issues in Africa, there's pockets of those same issues in the Western world. We just don't get to see it. But most healthcare professionals could exist. And that gave me a perspective that a lot of the solutions that the West is adapting using technology to bridge the gap, bringing access of quality medications to people irrespective of where they live. These are all the things that Walgreens put me in a position to understand how healthcare delivery works. Because one thing about the pharmacy profession is most neighborhoods in the United States, the pharmacist is the most accessible healthcare professional in the communities. Because you get to see people who show up to the stores to get milk, to get their cholesterol medications. You build a relationship with these individuals. You know what their constraints are, what social economic issues are affecting them, and you build a level of trust. So that just created an idea, meaning if this could exist in the US, we could build a solution that's not a Gambian solution, but a global solution to healthcare not being democratized, but intentionally take it back to Gambia, where now somebody else's Adja Fatim Menga could live not to be 56 years old, but could live to be 76 years old, 86 years old. And as we know in our culture, I don't know a lot of my history because I never got to talk to the people who are the libraries of our history. So healthcare has a human element to it, and that's the genesis of Innovarx Global. We literally decided that we have to be guardians of what health system we want to create. And being in the diaspora, having a comfortable job, always pointing fingers at what's not right in the system in the Gambia, it's an incomplete narrative of the healthcare story. Because since independence, the Gambia has never had a fully functional healthcare environment that is accessible to all. So Innovarx Global Health was literally designed to bridge the gap, but not to be a pharmacy, not to be a clinic, not to be a healthcare solutions company, meaning there's a world that exists between a healthy individual and an individual who is sick enough to have to go to the hospital. Innovarx Global was designed to exist in between that world. So to prevent as many diseases as possible and to help people who have chronic conditions live as long of a life as possible. And that's the genesis. And the idea started while I was actually in school. A lot of my classmates from pharmacy school or even undergraduate would tell you that I always knew that whatever I was going to do, I was going to try to take it back home. So I was very intentional about my early career, learning about technology that was being utilized now in pharmacies, where you could walk into a pharmacy in the US and get your cholesterol checked, get your diabetes level checked. Us pharmacists in the US come with a lot of clinical experience. We're actually underutilized in terms of our clinical skills with disease state management. So I constantly just started evolving the ideas. So a lot of the things that are manifested now in the Gambia, this process started in 2011, 2012. I was having conversations with some of my partners now in 2012, and it just took off. But in a nutshell, Innovarx is designed to leverage technology to make and keep people as healthy as possible by providing care in the most convenient way. That's who we are. We want to create as many people that could live a long, healthy life as possible, but also change the narrative. I'll be lying if the company isn't proudly African, because I believe not every good idea has to be foreign. I think it does something in the community if not only Gambians in the diaspora, but Gambians who live here start seeing excellence that is of them. Meaning if you come to the facility, you have a level of assurance that what you are promised is what you will get every single time. And it's a Gambian who could tell you, Ebrima, how are you doing? But the same Gambian who could tell you, Jerejef, Abaraka, there's that element of it. Because I think healthcare, there's a human element that you have to be empathetic towards the people you're serving, because that person could be your mother, your uncle. So that, in a nutshell, is Innovarx. And it's been a long journey, but a very fruitful journey as well.
Thank you so much, Dr. Badjie. And this is really, really, really empathizing, I can say, because, you are talking about issues, that I experience in my life, like you're mentioning about your grandmother whose death was at the age of 56, and with complications of hypertension and diabetes. But this is still the reality in many people in the Gambia. Different communities, we see the explosion, of diabetes and hypertensions, and now people way younger than 56 are being are affected by diabetes and hypertension, and there have been amputations and many other complications in our country. And life expectancy, sadly, in the Gambia is 61 years old. 61 years old. And that's really sad. And if we have a company that just come, our own and wage, to save life, so tell us some of the things that IGH is doing to fighting these many layered challenges to our healthcare system and delivery, especially non-communicable diseases like diabetes and hypertension. Go ahead, doctor.
Absolutely. So as a company, and partly if I keep on using Africa and not Gambia, because I believe Gambia is just a microcosm of the African, and we're not a Gambia solution, but what we saw about the sub-region is any average African, there's barriers to healthcare, which are normally cost, transportation, and just access, meaning you could have the money, you could have a car, but not have a good health system, right? But also one of the things we realized in the environment is not a lot of healthcare facilities in Africa are vertically aligned. And when I mean vertically aligned, I mean you could walk in and know that you could get the proper diagnostic tests, find out what's wrong. A qualified doctor who now with technology could be in the Gambia or abroad tells you what exactly is going on. And also you leave with prescription medication that you know quality is not something you have to think about. If it's supposed to do this, it would work. So the company's services were literally designed to be a one-stop place for somebody's healthcare solutions, but starting at a place of prevention. And this is something we made it so intentional that we wanted Gambians and Africans to start seeing healthcare as preventative and as curative, that from the onset of the company, we decided no Gambian will ever pay to get their blood pressure or their blood pressure checked as long as we're in the country. So to date, we've tested, just the past 3 weeks alone, we've tested 1,000 Gambians at the trade fair at no cost, just so that you know what your numbers are, because you cannot solve any problem that you do not know. So that takes care of the barriers to cost. And with the program now, we're actually going into communities and doing preventative services, removing the barriers to access and transportation. So the company is built in a way that it provides diagnostics from both a preventative and disease state managing. So we're doing point of care testing, and all that means is a lab test that you could walk in and get your results within minutes. And with Innovarx from day one, we digitalize healthcare from day one. We have never operated as with manual records with the company. Meaning if you show up to Innovarx today, even if you show up again a year later, you would know exactly what your heart rate was, what your blood pressure was, because we believe one of the problems with African healthcare is there's not a lot of digital records. So there's not a history. So every time you enter a facility, you are starting all over again, which means you're spending the same amount of money over and over again, and there's issues. So this doctor that saw you last year does not know what happened when you came to Innovarx. So digital records is the foundation of our company, which is why we have Agasta as an EMR system, where every single Gambian who's been to Innovarx now has an electronic health record that they own. So the preventative service does that. We have our community pharmacy now. Being a pharmacist in the United States made it very easy for me to understand how do you deliver quality prescription medications at an affordable cost using technology to add safety parameters. And what that means is every individual who comes in to get a prescription medication from Innovarx Global, one, it has to be something that a doctor who is licensed to tell you what's going on has prescribed it to you. But not only that, but when you're leaving Innovarx, you're leaving with a digitalized prescription that is processed with your name, with the labeling to add safety features. So now we've created an ecosystem where today, as we speak, it is cheaper to get certain medications from the US prescription, cheaper at Innovarx in the Gambia than it is if you were living in the US buying the same exact medication, the same exact pill. So that's also what we decided to do. Let's build a system where peace of mind is part of the process, meaning if you get a prescription medication from the company, you do not have to worry about the sourcing, the quality of it. So that's a second arm of the company. I think the most valuable arm of the company is our Wellness on Wheels program, which is designed to meet healthcare where it's most convenient for the patients. Wellness on Wheels allows us to go into people's homes. So the elderly patients who might have diabetes, hypertension, it's difficult them going to health centers, waiting hours on hours to be seen when they could be managed from home using technology, virtual care. So now our nurses are going up country. They're going all over the region, helping people stay more just healthier in general. But even in terms of product delivery, working professionals that might have a headache or have a cough at the office could now literally go online and order a cough medicine, and it's delivered with Wellness on Wheels to your facility. And the most unique element about the business, I think, is what we did with the diaspora. From inception, we realized that Gambia, a lot of people say Gambia is a tax economy, for example. No, Gambia is a diaspora-funded economy. Every sector of the country is funded by diaspora money. So in 2021, you almost cannot have a business model that limits your market to only the Gambia, because every single individual who I spoke to about Innovarx in Gambia, the first thing they told me was, market is too small, not enough money in the market, business would not work. But if you have upwards of 4% of Gambians, or almost over 70,000 Gambians living in the diaspora, what is your market? Your market is different. Gambians have spending power outside. A lot of the money is coming in. The problem was, before Innovarx, most people, when your loved one is sick, you lose peace of mind. But not only that, if you have the resources to send it to Gambia, there is no transparent system of finding out where your money is going to and what is the health outcome of your money. Because healthcare is an investment. So it doesn't make sense for Ebrima to be in the diaspora sending $200 a month for a mom who's diabetic or hypertension, and you've never seen an electronic record telling you if she's healthier today than she was a year before. So the company designed products suited for the diaspora to once again tell them, trust us with the care of your loved ones, and we'll do two things. We'll deliver it as efficiently as possible, but we'll also be as honest as possible about the realities of their condition. So meaning invest in it early in terms of preventative care. Send them over to get screened so that you know where they are. But if they have conditions like diabetes and hypertension, we could make sure we manage it to the best of our ability, to the standard of somebody in the United States, if not better. So all those things are some of the features of the company that is just adding value to the company. And more than anything else, it's just assurance is what we sell. Peace of mind, knowing that now there's transparency, there's ease, and that grandmother, that mother could literally sit in her room and never have to leave the house for a healthcare need while still being managed continuously. That's Innovarx in a nutshell.
Wow, thank you so much, Dr. Badingolu Janneh Bitala angale kangoto mbe minfo kangale bi wolo mu mfango badingo mfango la Gambia molo mi ya lonko nyanta bulo wulindila ngam bulo ko sai ngo kontani bawo mfango la molo mi ya lonko nase mfango la kango fono wala natan kan anin fennata mi ya lonko asim makoy bawo na molbe fa kan mini ya lonko e manyen na fala dolla sanjo sanji tallulu ni mosita sanji tallulu diabetes ya fa wala na ma fa enin high blood ka fa me hypertension na ma fa na ya lanjuru ala kosi terale kam nsem fango tankano wo mu me belale pour ngata ngam fango la moma koy ninga ma koy aka koduwo kodisoto abebi na la Gambiale isaje boro lida se tala ase l'hôpital no ni jara ba man sadda mate ninkelano na mol mi ya lonko ya kungo soto na mol mi ya lonko ya miro soto fo nyin kusi fale ke nyanta proud la wala ku wala pour ngi makoy jannim bitala kodo sambala nga bondi Gambia nga sambadula do to akodo tinamurun na Gambia nyini be minnadi ila mobe dawoda ise molda ila nyin wellness on wheels wol mu molle timi ya lonko kata Gambia dawodale ni la mobe sasaring iseta ya check sasa you need to se communicate ya foye il after record la inya bala ise kodo tami ya lonka date koleala isaje kodo finance si banko kan mi ya lonko hospital jama may bi wolbe se kenole nga kuolta nga janjandi nga ke jurme fanko toti ase na mol nafa nyonte ni nandi la borol mu mebe ka bo America le so ni wol ka bondi jembina la woto le bawo modo ka bori si fala min samba wol choko mallo mo ite sa ko parasta mo late mo na fala bar nyini kam mi o minke mfango la mollo mo andi lafta fewo fenna ise hakiliten ko soto ise ajela mo hanna diabetes soto wallahi hypertension soto wo manyana sabula isiyo doya pour molite bali jele ni falite nyokam ni mama wolite nyojela ite story il fola no ite connection o kala nka desperate ku doro ngafo alale yake bar sai ala minke wolo mu another mole na fe na nyemi yalon ka semma koy pour na jararo bunda nsate sembentu ya ngamfo sembentu ya isaje se kayra tem mo soto be dunia dawoda nyini nata wala jam Dr. Ismail, then before I go to next question, we have Khadija who say, glad to see a product of Ndaos comprehensive on this platform and doing great. This is awesome. My own brother Lamin Kums Manjan says, brilliant so. And another Lamin Manjang, my brothers, the Manjang things of Gunjur says, bottom-up approach style of research and healthcare delivery to those rural communities. Thumb up Dr. Ismail for this breakthrough. We are even prouder as a Gambian. Allah bless. And Hadi Modunjai says, thank you, doctor. We are all proud of you. And Niman Setakeba Badjie Sora says, hello, Mr. Janneh, and greetings to you, Dr. Fatu Dabo, my own sister, says, thank you, brother. And Alasana says, your stores remind me of World Green, in the US, maybe, because he's in the US. Thank you, my own brother. And Lamin Manjan, Hadi says, Dr. Badjie is really interested and encouraging with your program. However, one thing we as Gambian healthcare workers should be proactive in providing information to healthcare checkup, as you have mentioned, healthcare record. The problem is average Gambians will start treatment, give them 2 or 3 months, sometimes less, that even then they will be reintroduced. They will be introduced some of the form of treatment. Thanks, Dad, as I may call you. Dr. Smiler, I'm gonna call you. I forget to call you Smiler. I prefer to call you. Doctor, and I have a couple of questions that I want to come, but you mentioned something. You emphasize since at early stage of your medical school, that you are going to go back and do something. And one of your interview, you said in one of your interview that you are inspired by Indian medical professional trained at the best universities all over the world, who return home to provide specialty care to their citizens. Is that part of your plans in future? And should Gambian diaspora medical professionals do the same thing?
Absolutely. And one of the things we did before Innovarx was started is my partner and I, who's a brother and partner, Dr. Gerard Mengang, and Jatu J. Those 3 people, Innovarx would not happen without them. Jatu is also a product of Ndaos and Gambia Healthcare. We traveled. We went to India at the time. My dad was the ambassador of the Gambia in India. And we saw something that to me resonated, where we went to all these super specialty hospitals serving millions of people. And we saw products of healthcare professionals from the best institutions in the world who made a commitment that they will not allow somebody else to come back and try to solve the problems of their nation. And to me, it was inspiring in a sense that if a country of almost 1 billion people could have that mindset, a country of 2.5 million people, we could revolutionize the Gambian healthcare system in a decade. With the amount of Gambian healthcare professionals that we have abroad in some of the finest institutions in the world, you just name it. The first thing that needs to happen is we need to build an environment that is conducive for them to come. So one of the ideas behind Innovarx with our global doctors network is, I am always keen to talk to a Gambian healthcare professional who lives abroad. Because now with the age of technology, with virtual care, coming back home to practice does not mean uprooting your family and coming back home. Technology allows a lot of Gambian healthcare professionals to be able to serve in their specialties virtually with Innovarx as a vehicle, as a vessel. So that's why I'm always eager to talk to Gambian healthcare professionals, but we also have to acknowledge the realities on the ground. Most of the healthcare professionals, you cannot train over a decade, because to be any doctor in any field of healthcare, at minimum 8 to 12 years of schooling in an environment with all these tools and come back to an ecosystem that does not have the tools for you to do your job. Because goodwill has to be practical. So I think there's steps to it. So I think, yes, Gambia can revolutionize its health system by tapping into foreign professionals, but also local talent as well, too, just by creating an environment where if a doctor is in medical school or a nurse is in nursing school, a pharmacist is in pharmacy school, they're used to the technologies, the digital health records, all those elements should be present in the system to make it conducive for people to come practice. But also, they should be the highest paid citizens in the country. Because if our physician ratio, for a lot of people, the viewers that don't know, for every 9 to 10,000 Gambians, there's only one physician or doctor. So just by virtue of supply and demand, these physicians should be the highest paid and compensated individuals in the country to allow them the incentive to forego a 6-figure salary in the US and come back and help. So I think there's practical ways of doing it, but I think it's already happening. I think that Gambia today is better off with an infusion of young talent in the Gambia. There's so many doctors in the ecosystem, healthcare professionals that I have tremendous respect for. Dr. Keba Marena, Dr. Lamin Jaite, both of the Lamin, Dr. Jaites, Dr. Babukar Sanyang, nurses like Marie Gomez. There's just a plethora of Gambian healthcare professionals that are taking matters into their own hands that maybe don't get the credit. So it starts with building the right foundation for healthcare professionals to find a reason to come back home, but start looking at healthcare as solving problems before you show up to the doctor for us to fix it. A lot of reasons why our health system is overburdened and under-resourced is because majority of Africans in general only go to a doctor when it's too late. Most people don't believe in preventative care, especially men, because most of the times women have a better propensity to be more in tune with their body's checkup than men. There's a joke that men only go see a doctor if something is bleeding, broken, or burning. But that's adding more burden on the health system, so our hospitals are overwhelmed. But if you get 100 Gambians who constantly check their blood pressure, their blood sugar, preventative care, they're talking about diet, exercising, I guarantee you a small percentage will have to go into the hospitals. So now the hospitals have an easier manageable load for them to perform at the highest level. That's how healthcare works. And we have to change our relationship with the idea of paying for healthcare, because healthcare is not free anywhere in the world. So we have to invest not only in people paying for healthcare if we want good healthcare, but the conversation always starts with our health system is bad, but Edward Francis cannot sustain itself when Gambians are only paying $25 to receive services that you may pay $300, $400 elsewhere. And if it's an emergency, paying $100 for a preventative service will save you from paying $5,000, $10,000, or if you have to go to Dakar or elsewhere, it's higher. So I think the conversation has to be very honest. You have to look at it from a layering system, starting with preventative care. And I think more healthcare professionals will come back. I speak to so many Gambian healthcare professionals who inspire me because they're actually more valuable in the diaspora and getting all the wealth and knowledge that we could bring back to the continent. So I think it'll happen. I'm very hopeful, and I think it's already began. And I think what this generation is doing is we are having conversations. Most of the young healthcare professionals are very open to dialogue. I have never reached out to a young Gambian healthcare professional who hasn't been warm and welcoming to the ideas, and always think collaboration, not competition, but collaboration, because they know healthcare should be almost conducive for collaborating and creating synergy. And I think it'll happen.
Thank you, Doctor. I think it will happen gradually, slowly but surely. I think it is important because I was reading the healthcare system of Cuba. I was reading about Rwanda and all those things, the exercise, the diets, and all those things all the time. The preventive aspect of health is so important, and I think Gambians will imbibe that and take that as part of their life to exercise, to not wait until you are hit by all kind of diseases. It becomes more expensive, more cumbersome, and all those things. Anyway, and from my own perspective, don't joke with your health. Exercise, diet, and all those things, because I'm just coming from cancer, as so many people know, and it will just going to waste your time. It's going to be costly and all those things. So the best way to go about this, prevention is better than cure, and all English saying. Doctor, according to buttress your point, according to about the number of doctors, the ratio of the doctor number and the Gambian population, according to WHO data, there are about 10,000 Gambians to one doctor. Is this a problem for IGH? And is this failure of procession of governments and the Gambians at large, is this the failure of them, our community? I'm not posing blame, but every individual, every system has a role to make amend things, but continuously our healthcare system has been failing continuously. It's the government and the Gambian people, but government specifically, because they are at the top of the leadership, doing enough to address the disparity.
So I think that's a very layered and complex problem. I know there's solutions.
Yes.
The first solution is high time Africa embraces telemedicine as a way to mitigate the problem. And I'll tell you why. On average, it'll take about 7 to 8 years for a doctor to even just transition to medical school and get the requirements to be able to practice at the top of their license. But also, healthcare is not something that is managed by only one physician. And I think Gambians, and not Africans in general, most advanced worlds now, healthcare is patient-centered care, meaning one patient has an ecosystem of healthcare professionals who are trained to make sure they keep that person as healthy as possible. So yes, our physician density is not desirable, but also Gambia has a very strong and talented nursing community that is the backbone of the health system. If you ask me, based on a lot of institutions, especially in remote areas, nurses are superheroes. That has to be acknowledged. So to all the nurses, kudos, flowers to you. But also an emergence of specialties like myself, doctors of pharmacies are now entering the market who, from a disease state management, medication therapy management, they're still underutilized in our ecosystem. So I think we need to reimagine what healthcare delivery is supposed to be, and not centered about only one doctor solving the problems of 10,000 Gambians, but more so a community of professionals who are collaborating and using best practices like digital records, standardized protocols, and massive campaigns on preventative care. That way, even if we do have one, cardiologist or one neurosurgeon, there's a small amount of patients who get filtered up in that system. I think the medical school is producing a lot of talent. It takes time. Cuba is what it is today because decades ago, they were very intentional about, we are going to produce so many doctors that it's going to be an export commodity, right? So I think the change is happening, but healthcare has evolved everywhere else in the world where you have to enable all the other allied supportive healthcare professionals around the physicians to create a more robust system. So the government, I think, kudos, because 20 years ago, Gambia didn't have a medical school. We do now, right? So now it's like we have a medical school, we're producing a lot of talent. Maybe support from the government could be, okay, let's make sure we create a system where from University of the Gambia Medical School, they gain access to get further training. And then gradually the Gambia will go from 200 doctors to 300 doctors, 400 doctors, but also educating people about, okay, let's get more doctors of pharmacies, because there are more doctors of medicine than there are doctors of pharmacy in the Gambia. Nurses with advanced training, nurse anesthesiologists, nurses specializing. So you build the health system fully. I think that's but technology, we have to embrace technology because it solves our problems. If we had 100 Gambian doctors from abroad using Agasta telemedicine to see patients in their facilities, We could build a telemedicine center in Badjie where it's fully operational without a single doctor being physically present. So technology is something we should embrace and just digitalize health records. Because with Agasa, and I'll give you an example right now, if a patient walks into Innovarx right now and checks their blood sugar, if you are a doctor even in Japan, the moment that blood sugar is entered, you get to see the results immediately. So you could make a clinical intervention, and even if you determine this person needs this medication, the pharmacy is right there. So the pharmacist collaborates, make sure the right medication is chosen for the right patient and delivered in a way that now you could ensure that there's a solution. So our health system is very, very complex, but I think it's just thinking about it more holistically instead of just focusing on the one problem as well.
Thank you once again, Dr. Kadi Janneh says, Mbakadi Janneh, wellness on wheels. That's healthcare amplified and providing employment to Gambians. It doesn't get better than that. That's really amazing. And Mr. Jawbanda says, Assalamu alaikum to you all. And Hadi Kulubali says, collaboration, not competition. I think Doctor is kind of fond of using these words in different ways. The intellectuals sometimes play with words because he used the crabs in a bucket mentality sometimes to describe the collaboration and competition in the juggling of them together. I think we will come back to that, Doctor. But to amplify your position also, Dr. Badjie, that is, people will see Gambia and say, Gambia is a small market and all those things, but arguably, I would have to emphasize, it says, the Gambian diaspora, they sent around $500 million US for relatives and friends in remittance each year, forming a not insignificant part of the Gambia's national GDP. So if we approach yearly, just looking at Gambia's economics, and the opportunities there from only 2 million or 2.3 million, you're making a lot of mistakes, and fantastically foresight for you and relative, that the question is, does this inspire you to using tech-enabled health platform, using the best virtual care and tapping into the energy and financial resources of diaspora Gambian? You must be very intelligent to see this when all the medical people I didn't see this all around. Go ahead, Doctor.
And I'll tell you why. There's a typical profile of a Gambian who's lived abroad. You see how it's supposed to be, but every single day your heart aches because you know that's not how it is back home where you have people that you love. So the Gambian diaspora has been in that juxtaposition for a very long time, knowing that they don't have peace of mind when it comes to healthcare for a lot of different reasons. But from an economic standpoint, I want all the viewers to ask themselves, how long does $1 sent from somebody in the diaspora stay in the Gambian economy, in Gambian hands? Our economy, if you look at Asian economies, the Asian dollar circulates in the community almost 30 days in the community because most of the places of business of value are owned by people in the community. But if you send a relative $100, ask yourself, how long does that $100 exchange hands within the Gambian? So yes, supporting Gambian businesses is important, but also it means more if people in the diaspora are now putting resources to a place that they could trust that quality will be consistent, but that place of business is now not only hiring more Gambians, but you're increasing and allowing that $500 million to stay within the companies. And that's how nations build wealth. So I tell people all the time, for every IGH customer, as much as I appreciate you supporting the business, you are allowing me to employ over 50 Gambians, which we do have right now, under our payroll. As a small company, and I don't say that I say that just to highlight the contrast of a new company that's also very intentional about not only creating opportunities for young Gambians, but holding them to a standard that excellence has to be our way of life, to a point where If you walk into Innovarx Global and you're Gambian, you would be proud. If you walk into Innovarx Global and you're not Gambian, you respect Gambians because you see Gambians providing excellent service. Anyone who's worked for the company, who's been with our company, knows that I preach that, because for every dollar that we get from the diaspora, we want to make sure that we provide you more value than anybody else would and let that money circulate. So as valuable as the diaspora is, I think it's time for our country to have businesses that also value that dollar or that pound that's coming from the diaspora by giving people a level of service that if you're traveling, you should not know the difference. Right? So the diaspora, that's why when we started the company in Atlanta, Georgia, talking to people in the diaspora, not the Gambian population, because we understood the dynamics. Most people don't have resources. Gambia is still a very poor nation. But if you want to bring a standard of care, it has to be a collaborative effort while trying to bring the cost of healthcare down. Because when it comes to healthcare, whether you have it or not, you're going to have to find a solution. If not, that's how we have Gambians not living. So the diaspora economically, it's more than just healthcare. It's what it does to the community by keeping the dollar in the Gambia.
Thank you very much, Dr.
Senegal makes a lot of money from Gambians. So there's a lot of...
I'm just coming to come there, Doctor, because we Gambia is not only on your area. Gambians need to, jettison fear, and know that, people who are receiving some of the money or most of the money that we are sending are being nationalized by other foreigners. You will think that this is Gambian GDP is doing this, and no. If other companies are there taking all the money and sending it back to their country, they are nationalizing your economy and they are developing their own places. The money don't stay with your people. All the hard work that you're doing here, we need to reflect and ask ourselves, what can we do to make sure we support our own, so that the money from our own brother, Dr. Sumaila, if I will call you, as I always want to call you, will stay in that country. It will not go anywhere. It will create employment environment for our young people to go and train, to learn skills and all those things, not just from hand to mouth. So this is so important. Doctor, it's over $1 billion leaves African continent every year because of medical tourism as a result of chronic failure sometimes and lack of trust in our healthcare system. And in our own small Gambia, most of the money that we send here, a lot of people that we want to, because they don't trust our system, cross to Senegal. Sometimes they go to India. Sometimes they go to Turkey to spend the money that we send to them. And that money is not really staying in the country. Is IGH considering weighing in order to tap into the Gambian resources and injecting into the countries so that the money can stay in the country and we can fill that gap? Once again, what we are talking about the new company that is in the Gambia, not as new as it is, because they started in 2015, but they went into the Gambian market around 2019. But so far they have revolutionized, and want to democratize, the delivery of healthcare in the Gambia. You can be in the Gambia and have first-class medicines from America. You can have first-class treatment online sometimes, and the wellness on wheel. These are people that will go wherever you are in the country and help you to get your medication and your situation there, all taken care of. And you will see your record. The transparency there also is second to none. So it is important. And the founder of this fantastic innovation is Dr. Ismail Badjie, one of our Gambian youth that's been in the forefront, and his team, the company Innovarx Global Health, IGH, they are now operating in the Gambia. They are online. You can call them anytime so that we can use this fantastic service, not only to use it, but we will be able to follow transparently the health condition of our people. Nobody is going to tell you. You can be called, you can give all the necessary information, and the data will be there. Anytime you want to have access to it, anytime your relatives, your family, even yourself go back, your records will be there, and they will be able to tabulate that. They will be able to tell you some of the things that are happening into your body. But as we always say, this is a proud moment. This is a pace-setter moment for Gambian, so that our brains, our doctors, our resource people, the human resources is lacking in the Gambia. They can be inspired by some of these things. Even if you cannot go physically, but you can harness technology so that you can benefit that country and be part of the process, so that we can come together as a people, collaborate, not compete, to make sure we develop that country. It is important, once again, to know that this is the finest Gambians among our illustrious people who are building one of the best institutions, because we have to be well. We have to have good health before we will be able to do anything. Dr. Ismail dropped down for some reason, but I'm sure he will come back, so that we have a lot to discuss with Doctor, and so that our people can know that this is a facility that is happening in the Gambia. And the whole issue of counterfeit medication, where nearly 20 to 30% of Africans' medications are counterfeits. You are safe from that, because these medications are directly from America, and they have been censored, they have been accountable. We are 100% sure they are not counterfeit medication. They are good medications. But the whole intention is they are employing young people in the Gambia who are going around delivering medication, checking people's blood pressures, and the data, the information is sending to doctors all over the world. What a fantastic thing to have. Once again, being a program of Minnesota Kumaya to Baba Bakele, Bao new initiative let all kukutola mi yalon kanata na banko kam mfawla banku dingo mi yalon ko fodin ke do e ka fa ko Dr. Ismaila Badjie mi yalon ko a company create wala a company that company mi yalon ko ni la molu mankende Dr. Rol sita tarabe dawo da Gambia banko kam yes yala la rankan inabe kachala ibala blood tala wala ibala yellow tala wala be lafta feo fentala pour ka check kala ko kisi ka jibe musa sa sifada ba ni wolta doron a wola ran fango ko to je be sirinda mi ngala suo kon wo information o bitala doctor wol yale mini ya lon ko be America doctor wol mi ya lon ko be dunia dawda isa check ya jibe min ketar nata na borule anyanta borole sanna wala anyanta fenni nyanta kala le tol so foy isita ila mol mi ya lon ko ikafuta molle be dawda be Gambia je wol site la pharmacie ngoto ni la mol se kacha mosina ani wo boro sina sadire bar ni jara ye feo fem foje wo fanan wo katara boro nyin katara je la katara ka information o mago bawo most of the time what jama ni tata lopitan so ma fa ni murun taje ani docteur kilo fa abuka lo mete mu jamale ti koten ay naka ko be ko masi koten wo ka time o wesle isaji time jamaita mi ya lonko amam betea bar nyini la system o be jamin hannen dan non sanji tan koten nom ni murun taje ba fole ko inene nata janne sanji tan koma nyinne kete lambatu ngo follow jibe fo hadisa ila problem mo wallet isaje ise jara rota so ko bebe coordinate lale isaje ko be se nyo kala muta ise jara ro futandila andun imanta l'hôpital fam na jara ta fane nyanta tala l'hôpital e itolbo ko indile lale so nyimu kulete mi ya lonko e kodu kodi dada bawo ni ajibe serun damma ye momin jata do fo mo wuli lul about 5,000 patients. Not only that, but ye more ke wuli fula ye woltale ke free ke la yeloli test ka kuoli jibe la sasa be nyaadi fo sasa le be jatol konan all those ni wato ni yele siya be kere ni sukur kuran be kere wolu mu kuran ne mi ya lonko ni wuli tala juna min nyanda ke lay woke wo kuran o banyan ne fal bar jama Gambia mo jama ila sanwa kadanda me kadasa sanji tan woro lale walla ye tambara do mandindoro ye fa andu woma nyanna kela bawon ka banko li jeremi ya lon ko mokata fo sanji tan kononto sanji keme abala ko la ko bebe betare Gambia finance wo kenole nin taranu ngamuta nyofe nin taranu ngalon ko nyanta min kela sen business also support min ya lon ko be nyinyama isen kamo jamfandi wokum mayata baba kele I only hope Dr. Badjie is hearing us, or is he coming back, so that we can continue to talk about some of these issues which are so important. We have a lot to discuss. We have a lot of questions to ask, Doctor, and this is important. It will inform us. It will give us the synopsis of what is going on, what this country, this company is doing, companies that harness technology to enable us to have a platform that will give us a good healthcare delivery system all across the country. And when this is successful, it is going to be amplified to other places in the Gambia because they have one brand. Okay, I think we will have a short commercial break until Dr. Ismail Badjie resumes back, and we can continue with our interview so that he can shed light on some of the things that our viewers want to know. Thank you.
The days of limited access to quality medications and healthcare services are long gone, with Innovarx Global Health ushering in a new era of healthcare delivery in Africa. IGH now offers an all-inclusive care plan designed to provide a comprehensive management of chronic diseases, such as diabetes, hypertension, and other ailments that require close monitoring and routine medications. Our global clinical team leverages technologies such as point-of-care diagnostics, telemedicine, Agasta cloud-based electronic health record system, and electronic prescription processing of FDA-approved medications to effectively manage patients and produce positive health outcomes. The plan provides a peace of mind to patients in the Gambia and their loved ones who may sponsor from overseas by providing 4 free prescription medications a month, 4 diagnostic tests a year, free wellness on wheels delivery from Banjul to Basse, 10% off all products and services, all for a price less than a cup of coffee a day. D $38,050 a year. Flexible payment options available. Why travel abroad to receive quality healthcare anymore when IGH can bring the quality you deserve to your doorsteps? Sign up today by calling 220-232-4224 or emailing careplans@innovarxglobal.com.
Yeah, once again, we are back, and I'm not sure what is going on with Dr. Badjie's network, and I'm afraid if he is in the Gambia, I'm not sure whether he has to. Nawek is in the chronicle power supply problems that we have in the Gambia might be the issue here. And because somebody is just alluding that maybe Dr. Badjie is in the Gambia, if that's the case, it will be unfortunate, really, because that means we have to cut the opportunities anyway, and I'm not sure if he is not coming for some reason, one way or the other. What we need to do, we kind of have to stop the interview, and maybe when times allows and when it is appropriate, Dr. Badjie will come back again, and we can continue our discussions on some of the very important points and topics that we want him to shed light on, to tell us more about the new company, the IGH, what they are doing, some of the hurdles that they have in the Gambia. One of the questions that we are going to ask is, the inconsistency of electricity and the internet, and how that affects the business and the bureaucracy in the Gambia, the import duties and all the taxes and all those things. And in this COVID also, they've done fantastic in collaboration of Ministry of Health to do a lot of corporate social responsibilities, hand sanitizers and all those things in the Gambia. So this is really, really inspiring and very, very yes. I have now. I confirmed that Dr. Ismaila is he's in the Gambia, and the internet issue there is a nightmare. I think Lamin, I think we should wrap up this. I think we should wrap up the program since Doctor is having internet problems in the Gambia, or electricity problems in the Gambia. So once again, you have to visit their website, the Innovarx Global Health, that's www.igh.com, and see what are some of the products and services that they offer. They have their number also that one can search and call, and ask and see what benefit they can be to your people. But if we support them, we are supporting our own, we are supporting our country. And when they progress, they will pluralize some of these things all over the place, and it will even be better, with the intervention of this, fantastically innovative way of, healthcare delivery. As Dr. Badjie says, he knows the solution, and if we give him our support and the backing, probably in few years' time, the healthcare system in the Gambia will have competition. I mean the government healthcare delivery system, when we have the private healthcare system that can go into our compounds, in every nooks of our country.
Hey.
Yeah, doctor. We near. I know, you have internet or electricity problems.
No, internet. I feel like the whole country is being put on trial right now in terms of our infrastructure.
Yeah. Oh my God. That's really, that's really, really unfortunate. But we are glad, we have you back anyway. And we were at the point where we said we have about over $1 billion leaves African continent every year because of medical tourism, as a result of chronic failures and lack of trust in our healthcare system. And in the Gambia, we see a cascading of Gambians cross border to Senegal. Sometimes, because of fear, because of lack of trust of our system, because sometimes what they go to Senegal can be provided in the Gambia. Actually, they didn't ask. I have a couple of people, they didn't even know what happened to them. They go to Senegal, they end up paying their accommodation, their food, and all those things. And you have all this cowboy healthcare system that's just kind of fleecing them from their monies and all those things. And this is a big burden on us. But sometimes now people are even going to India, to Turkey for, is IGH considering weighing in, to tap into the resources of Gambians, so that, what they are going into Senegal for, we can have it, we can provide it. We have a company that can provide most of these things for you in the Gambia, but the country is losing. I think Senegal is dancing now because, they kind of nationalize our economy and doing everything. So you have influx of Gambians going into Senegal and charging them with exuberant amount. Their accommodation is too expensive. Even if you are in the diaspora, it's almost unaffordable. You cannot keep up with the cost of medication in Senegal, especially India and Turkey. Those are even sometimes worse. Even the transportation fee to go to India or Turkey, and the time waste, before you have the documentation to travel, you virtually sometimes died, and that's it. Go ahead, doctor.
No, I think that's one of the reasons where, I always like using the word collaborative when it comes to healthcare, because I think India and the Senegal health system is of value. I don't want to understate their value, especially cases that the Gambian capacity is at its limit. There's a lot of cases where you do need a professional and the closest time, most of the times, especially if it's an emergency, is Senegal. That notwithstanding, there has to be a re-emergence of trust in Gambian healthcare professionals too, because we also find that our ecosystem sometimes is more forgiving by not getting health outcomes outside of Gambia than they are not getting health outcomes in the Gambia. So there's time and time, especially now where there's an infusion of talented healthcare professionals here, it's still a challenge with people just realizing that the information, clinical information that you're being provided here is of the same caliber quality than somebody else who is in Senegal or in India as a professional. With that said, a lot of healthcare professionals should know where their limit is. So I think it's both ways. So I think part of it too is like from a prevention standpoint, I do believe that Gambia right now, when it comes to preventative health, has enough resources and talented healthcare facilities that if just finding out how healthy you are is what you're looking for, which should be the majority, places like Innovarx happen, that's where we exist. Because if you come with a complicated situation, sometimes the solution we offer is telling you that we don't have a solution for you. And being very honest, especially with people in the diaspora that may reach out, when most of the times matters are a little bit more critical where it's outside the confines of what we can do. So I think part of it is just one, engaging with the right healthcare professionals, establishing trust, but also knowing that quality does not equal foreign. Quality could also be homegrown. And I think that's not even a healthcare thing. We as a continent have been programmed for so long to always think that quality could only exist outside. And it's ironic, especially the Gambian itself, so much of the quality that you meet outside are Gambians. So it's very counterintuitive because so much of our talent is being benefited by people who are not in the continent. So I think healthcare from a prevention standpoint, quality is in the Gambia, assurance is in the Gambia. I think we should start demanding more from some of the facilities like Innovarx, hold us to the standard where if you need your records, find out what's going on. But Dakar still serves a critical role. In India, we have very valuable partners in India, especially with telemedicine, BLK, that are of value. Because once again, there's a lot of specialties that are not available in Gambia.
Thank you, Doctor. And Doctor, you source your products from the US.
Yes.
Solely. You must have sometimes some difficulties in getting them to the Gambia. Especially in what we are in the COVID time and all those things. How do you mitigate some of these bottlenecks that you have? I'm going to ask about the network system of power supply.
Yeah, I think 2020 was a very challenging year for us in terms of supply chain, right? And I think it's not unique to healthcare. It's not unique to Gambia. Anytime the world sneezes, Africa catches a cold, which is why the same thing with the vaccine shortage right now. Supply chain is just the biggest challenge that a lot of businesses in healthcare are facing, right? Even with the situation with the Suez Canal earlier during the year, there's business people who ordered products in January and still have not received their products. From a healthcare standpoint, the reason why we source our products solely from the US is two things. Our team, myself included, were US trained. I've worked in community pharmacy since 2008, over a decade of experience. I understand medications, how they move in the US. I understand what generic medications can do to minimize costs. And from a business standpoint, I understand the less middlemen that you have, the cheaper the goods could be for the consumer, including generic medications. So yes, we source all our prescription medications from the US supply chain, but there are some generic medications now in circulation with IGH that are cheaper, the same pill, for you to get in the Gambia than it is in the US. That has a lot to do with generic medications don't cost money. So why the United States? It's nothing particularly special. The fact of the matter is the United States does a really good job because of the FDA with protecting its consumers by making sure every product on the market, somebody in the US or even in UK, you don't walk into a pharmacy, get a product and leave and think if this is quality or not. Nor do you walk into the pharmacy and they have two types of medication that should do the same thing. And just because this is from France, and this is from this place, this one is more expensive. So the US just allows the protection in terms of the FDA, knowing that these products are vetted. So now our loved ones could get the same assurance that they deserve, the same way as somebody would in the United States. But if Africa becomes a manufacturer of generic medications that uses, standards, global standards that we could sell in the US, then I guarantee you Innovarx Global will always be in the position to source from sources that are guaranteed. Our policy has always been any product, be it a medication, be it a retail product, if it's not good to be sold in the US or in Europe, we believe it's not good to be sold by Innovarx to the people that look like us. So our sourcing tends to come from that, because even the US market, what a lot of people don't understand is a significant amount of generic medications are manufactured in India for the US market. So India sometimes gets a bad rap, but they actually are giants when it comes to generic manufacturers that are in circulation in the US. We just want Gambians, Africans to have access to the same medications that are vetted as quality so that it could be distributed. And that's the whole idea about being access equalizers, about democratizing access, but also lowering costs. Because a lot of people think, okay, these products come from the US, their medications are expensive. No, the average prescription in the Gambia at Innovarx for a generic could be $6. Anybody who lives in the US knows that even with insurance, what you pay a month for one medication for diabetes or hypertension is more than $6. So you could arguably say that you get more value for healthcare because an Innovarx is in Gambia than you do. And we have customers now that go back and forth. I'm an example. So a personal story, I'm hypertensive. You can't tell by looking at me, but once again, that's always a sign. I use myself because if it's genetic, you have a predisposition where if hypertension, diabetes runs in your family, you have a high likelihood of getting it. I am healthy. Most people that know me personally know I'm a fitness junkie, but I'm still hypertensive. I take medications every single day to manage my hypertension. My medication today, it's cheaper for me to buy it from Innovarx Global than it is with insurance in America. So I fill my medications at Innovarx because you're creating value by leveraging quality generic medications where you're making it cost effective, which is why we were able to formulate plans where we could give people 4 medications a month at no cost as a subscription. So the model supply chain affects us, but I think a lot of the quality with the US is just assurance. Getting a product that is supposed to do what it's supposed to do. Only in Africa do we question quality of medications, but in Western world, for you to sell a prescription medication, it has to be proven that it is safe, meaning it won't cause any toxicities or harm, and effective, as in it is more effective than placebo, meaning taking chalk pills. So, and from a finance standpoint, if US does a good job sourcing medications, Innovarx doesn't have to invest in quality control for the medications we buy. That ecosystem is already the quality control. So even if I have to pay slightly higher fee, I know that 100% of the products are quality. But supply chain challenges will always be an issue. It's been an expense for the company, especially a young company. But it's just something you have to mitigate. But I think it's a reason why Africa as a continent should start thinking, let's manufacture. We have pharmacists who are capable. We have manufacturing companies who are capable. East Africa is ahead of the curve. South Africa is ahead of the curve. West Africa could also be the hub. Why not Gambia? Gambia can be a hub where we manufacture generic medications, where our entire population of 2.5 million people could have cheap medications that is effective. That's the one way of mitigating supply chain. If you don't want to suffer the consequences of supply chains, produce locally. That goes with medications, that goes with food, that goes with any single product. If you want to mitigate supply chain challenges, start creating an environment that allows entrepreneurs to produce locally. And once again, economically, the Gambian dollar stays in the Gambia. That's how wealth is created. That's how China has more millionaires than any other continent, because value creation. So I think that's always been the perspective, just quality that we get from the US. That's pretty much it.
Yeah, thank you, doctor. That also answer the counterfeit medication allegations that are going on. Yeah. We're going to go to the next question, that is, you played a very important role, that IGH, in the country manufacturing high hand sanitizer, during the middle of the COVID pandemic, in collaboration of Ministry of Health. This is fantastic. As your corporate social responsibility, you're doing a lot in those areas. We are going to the impact you have on youth and the free testing of people's, the blood is and many things and all those things. Tell us about that collaboration with Ministry of Finance, Ministry of Health. When things are really challenging for third world countries like ours.
Yeah, absolutely. I think COVID was a good opportunity for Africa to look itself in the mirror, including Gambia. And as the saying goes, necessity is always the mother of invention. So if the country is closed, supply chains stop, and you can get something as basic as hand sanitizers, us as a pharmacy, myself as an individual pharmacist, part of our training, which I think a lot of the ecosystem is, they're not as familiar as how trained us pharmacists are. Compounding is part of our training, and I was trained in compounding, meaning we could manufacture medications that are not commercially available. So hand sanitizer being a simple formula, it's one of the simplest formulations that a pharmacist could make. When the need arose and we realized that there's a shortage in hand sanitizers, the ministry obviously was in active collaboration with the Pharmacy Council of the Gambia. Right, we figured as pharmacists, now is time for us to infuse our value into the community, but do it in a collaborative way where we could join in, come up with a formulation as pharmacists, and provide a solution. So that was all that was. We figured out, okay, hospital systems need hand sanitizers to make sure we minimize the spread of the COVID virus. And it was just a good opportunity for us to, as pharmacists, as a profession, it was a proud moment for me because it was adding value, but also it just solves a need where we started producing it locally. We launched our Safe Hands programs, which we created hand sanitizer stands and locally produced hand sanitizers for companies. And now that supply chains are easier, there's been an infusion of hand sanitizers. So I think that collaboration was just a good opportunity as a company for us to reach out, get more connected with the Pharmacy Council in the Gambia, start finding ways to collaborate with the Ministry of Health, because we're part of the ecosystem.
Thank you, Doctor. And Doctor, you are able to service and deliver products to clients across the country from just one branch, and that is maybe in around Serekunda or Banjul area, around those areas. If my old grandmother is in Fatoto, and with complication of diabetes and hypertension, and I just, purchase some medication for him, is your WOW people going all the way to Fatoto to deliver the necessary service or the products that's in it?
Yeah, 100%. When we launched our Assurance Care Plan, and we intentionally called it the Assurance Care Plan because it's designed to give people in the diaspora and people here assurance. It was designed to bring quality healthcare to the footsteps of people who need it the most. So if your loved one is in Fatoto, before we give any individual medication, which should be standard, the first thing we do is get a comprehensive wellness screening that gets to assess where you are from a healthcare standpoint, gets you an electronic health record system, and this loved one in Fatoto needs 4 medications to manage their condition. And any clinician who understands diabetes and hypertension, having access to the right medication that you take every single day, adherence, it's way more important than the quality of even doctor or hospital that you go to. The key to success is continuity of care. So that loved one with the Assurance Care Plan is, we were able to do a comprehensive wellness screening, and every single month, the pharmacy team will deliver medications to her doorstep, irrespective of where she is in the Gambia. And why that is so important is a lot of our loved ones, very rarely do they have contact with a healthcare company every single month. So if you come from Fatoto to, let's say, Banjul, Edward Francis, you see an amazing doctor, they tell you take medication X and just go and buy it. Everything that happened in that process could go to waste if two things happen. If the grandmother goes back to Fatoto and the entire Fatoto area, you cannot find the medication that the doctor prescribed, or if she purchases a medication that is not vetted and is of substandard quality, she could take it religiously every single day and not get the results. So Wellness on Wheels was literally the answer to that solution. Like, okay, we know that there's value in managing people continuously. So now that loved one, my nurses just actually got back from upcountry today, are able to not only deliver medications every single month, but also every 3 months for diseases like diabetes. There's a test called an A1C test that any diabetic, every 3 months, you should get an A1C test because it determines what your blood sugars have been running for the past 3 months. But it also determines how effective is the medication regimen you're on, or even the quality of the medication. So the fact that the grandmother now who lives in Fatoto comes to the facility that one time in the year to do her comprehensive screening, once she goes home, she gets medications every single month, and every 3 months she's getting a clinician who comes to the home, see how she's doing, are there any social factors that's affecting her health, how's her mental health, which is something that's also we forget to check in on our loved ones. But to answer the question, absolutely. Wellness on Wheels is designed to bring the care she needs to her every single month. The only thing that we normally ask is the first time she needs to be assessed as a comprehensive screening. So a patient could only show up to IGH one time a year. And the rest of the year, they're in where they live, and Wellness on Wheels is coming with motorcycles, with vehicles, but that's the promise. And I think that's the value of the assurance care plan, where somebody in the diaspora, for sometimes something cheaper than a plane ticket, because our assurance care plan is $760 a year. And that gives you a comprehensive wellness screening, and every single month, up to 4 medications are delivered anywhere in the Gambia at no cost. And you have an electronic health record. So anytime you need to know, how's my mom doing? A nurse could tell you everything to the detail, as in her heart rate was 77 the last time we saw her. So that's Wellness on Wheels, which is why Wellness on Wheels and IGH is a global solution. Because this solution could go anywhere in the world and be of value. Because the nature, that grandmother in Fatoto, I guarantee you, with Wellness on Wheels, is getting more attention and care than somebody living in the US, using the same medications because of supply chain as somebody who lives in the US. That's Wellness on Wheels in a nutshell. It's one of our most powerful platforms that's revolutionizing how healthcare is delivered in the Gambia. And that's what we mean about democratizing access, meaning now you're instituting agency, dignity, humanity back into somebody, where now Gambia is not the land of the haves and the have-nots, meaning everything nice is Serekunda, Banjul, and then the rural area are forgotten. But Wellness on Wheels, some of the things we want to do with technology, using telemedicine in rural areas, all those things are just going to be additions to how we want to deploy our solution across the continent.
Wow, Doctor, this is too good to be true sometimes. I can't just, I feel emotional and really the opportunity that is there for us, to save our people, for them to have, wherever they are, to have a continuous medical checkup and medical cover, but one of my own mothers and my sisters at the same time, he said, they are coming to Gunjur all. I am paying for their service. Are you going to Gunjur? Because we are very Gunjur buyers, and we are very proud to say
now,
that,
we might have to adopt Gunjur as a community. We just might have to adopt Gunjur. At the minimum, we'll definitely be intentional about planning what's your number event for Gunjur, so that we could offer free screenings for diabetes and hypertension. So that you could promise me, I could promise you before the end of the year, we will be Gunjur offering free screenings for diabetes and hypertension. But what's your number? For sure.
If you want to be successful, you cannot be in the Gambia without being in Gunjur, because it's the nucleus of that country. I will assure you that, Secretarians might disagree, but that's the reality, But we were going to wrap these things up. We've been here for a long time. Very soon. Your business model is unique. You're the first mover, in this type of business in the Gambia. One, you tell us about your competitive advantage. You don't have to tell me that, and what is the reaction of your competitors, because, most of your competitors might not be Gambians, but any company will try and create barriers for newcomers, but I know your model is different, it's unique and all those things, but still, you will have hurdles. You will have, I'm going to ask you that you're launching before that, some of the difficulties that you have. You can merge all those into this question. What is their reaction? In a few ways, you can tell us about your competitive advantage. Don't tell me if you don't want to, but go ahead.
I think the honest answer is, I don't know, because I've never viewed Gambia as the competitive arena. I've always felt like we have a global solution, that we were intentional about Gambian people being the first community to receive it. So our business model was never, we studied the Gambian market, but if you're successful in the Gambia, it's not success. It's 2.5 million people, right? But it's also an ideal location to see if you have a proof of concept, meaning you could test your idea to see that it's valuable. But so from a competitive standpoint, I don't think I've ever taken a competitive stance, because I honestly don't believe we are our only competitors, which is why all the Gambians that work for Innovarx, I constantly tell them that we are competing with the world. And I think Gambian businesses, we need to start flexing our competitive muscle on the global scale. That way we start attracting investors and confidence. That's one element. But the reality too is, anytime quality is introduced in the market, you cause tension. And we see tension as something negative, but tension from a business ecosystem is a good thing. Because if a patient who's been using a facility that never had electronic health record systems, that never had delivery given to them at their homes, that never had prescription bottles that told you, Ismail Badjie, lisinopril 10 milligrams, take it 1 tablet a day. Now, 2 people have to make a decision. The consumer has to make a decision, because now they know there's an alternative that is clearly of higher standard, but also the local ecosystem have to make a decision to adapt, or gradually they will die away. Because for so long, Gambia is an ecosystem where most businesses could get away with getting people's money without investing in improvement, without investing in technology, and without investing in Gambians by training and giving them job opportunities. So if Innovarx, by nature of positioning, creates tension in the market that leads to a higher quality, the market benefits. So even if next year there's 5 companies that are doing exactly the same thing, now a Gambian customer getting electronic records is the standard. Now a Gambian person getting delivery at their homes is the standard. So the consumer benefits. But anybody who's been following the trajectory of Innovarx, we have been positioning the company not as a Gambian solution, but as a Gambian entity that's operating in the Gambia that has a global solution, because we believe that our product could compete on the global scale, and it will only bring us joy and pride if we could hang our flag as the Gambian people in it. So I think that's the honest truth. So all the difficulties, barriers of entry, I could dwell on everything that happened up until the 6 years it took for us to open. But what that did is allow us to sharpen our axe. So they say if they gave you 7 years to cut a tree down, spend the first 6 years sharpening your axe. And the 6 years that we faced difficulty, our business model evolved. We got more information. We learned from the system. So when we struck, we knew exactly where to cut the tree down from. And if consumers benefit, the better. And that's the honest truth. If 10 years from now, Innovarx is not a global entity that's bona fide as a solution, I would consider all the sacrifices a failure. but I'll always be proud that Gambian people were the people who benefited from the solution first. The competitors, I don't lose sleep over.
Wow, Doctor, I'm really, really amazed about your audacity in a good way. Anyway, that's a big target for yourself. But you are pride, for all Gambians, and I think a lot of Gambians here, most of them are saying this is fantastic. A lot of us are not aware of this. From now on, all of us have somebody who has hypertension, diabetes, and we are struggling. We don't know what to do with them. Sometimes we will try and send multivitamins from here because we cannot get some of the diabetes tablets from the counter in the UK. They are restricted here. It has to be prescribed for you. So now you have the democracy, you have the platform, and you have the accountability that you are in control of this, to take your people to these people's office, the Innovarx office, so that they can take care of your people. They don't have to die with their diabetes, do something now, save your people. Don't be there, you don't know, you're confused, you don't know what to do. Your people can live. They are not old enough, they are 56, they are 60 years. They can still live 20 years again when you contact these people. And they're Gambian, they're honestly going to tell you the truth. They are not going to give you any counterfeit or any wrong information. If they cannot do anything, they will let you know. And they are wellness on the wheels. These people can go anywhere. Even the Secretarians, they are not that much aware. But I think they will take this opportunity, to flux in your office, wherever your shop is, and you will tell us where that is, Doctor. Also, I know they are online, but you will tell us at the end of the day where your shop is. If there's any number that people can take also, so that those who cannot go online can just call their people probably tomorrow, so that they can come to your office and they can take care of their hypertension, their high blood pressure. And I think, Doctor, your you are doing fantastic, and you are a pride for Gambia. But in terms of corporate social responsibility, what are you giving back to the community, especially youth, citing that the Gambia has more than 60% of our populations, under the title youth, Go ahead, Doctor.
No, I think that's true. We're a country full of youth, even though Gambia is also one of the few places that you could be 40 years old, married with 2 kids, and still be considered youth. But I think in terms of our corporate social responsibility, it's something that I'm extremely proud of, and it's twofold. One, from a healthcare standpoint, prior to Innovarx, the 6 years, I realized that even if somebody wants to get a blood pressure checked or blood sugar checked, you had to pay for the most basic necessity. So we decided, even if it's going to cost the company, we are going to choose preventative care as our CSR. What's Your Number, which is a program we've been doing since we started. What's Your Number is designed to show up in communities, but even if somebody walks into IGH, they never pay for blood pressure and blood sugar, and they get an electronic record. So we've interacted with Gambians from all over the country, where some of them, it was their first time getting their blood sugar checked as a youth, first time getting their blood pressure checked, but also first time getting an electronic record, which means a lot because it just empowers and engages them into the health ecosystem. So that's been our CSR. We continue doing it. We want to screen about 10,000 Gambians between now and next year. Just this past couple of weeks with the trade fair, we screened over 1,000 individuals, and a lot of them were young people. So I think if you start having a conversation with people in their teens, their early 20s, about healthcare, about diabetes, about hypertension, about not eating too much sugar, watching the rice, exercising, that's how you create a population of Gambians that live past 61 years old. So that's one element. The second element when it comes to youth is I'm extremely proud of what we've done in terms of training, hiring, but also creating opportunities for Gambians. And to me, I've always known that for anything to be successful in the Gambia as a business, capacity is a problem. So we cannot only be a healthcare company. We also have to be a human development company. So a lot of times people that come to a facility or interact with Gambians, the first thing they tell you is like, you have a lot of young people working for your company. Yes, we do. It's intentional. These are the people who are the future of the nation. These are the people who are online, so they see the whole world is passing Gambia behind. So it allows us to not only engage by building capacity, but building relationships at the university levels, giving them opportunities to know how healthcare should be delivered. So I think both angles in terms of giving back is just something we're very intentional about. And to me, even when people say they're proud of what we are doing, I always tell them, be proud of the 54 Gambians that work for the company. Because every single day, they make a decision to not only be better for themselves, but to be better to make Gambian people proud and start linking Gambian with excellence. So 20 years from now, when a 24-year-old who started their career at Innovarx is 44 years old, they are an individual who could compete on a global scale. That is significant. We have nurses that have graduated from nursing school and started using Augusta electronic health record from day one. So their experience now is of the same level. You could take that nurse anywhere in the world and they would not be caught with theirs in the headlight. So I think the human development element is something that we're extremely proud of.
Yeah, thank you, Doctor. Somebody, Kadijaban said, I was going to read this openly. The store in the Gambia is in 100 Fatu Golden Plaza, Bertie Hardin, Bertie Hardin Highway, KMC, the Gambia. Call on WhatsApp is 00220 286 6200 or 00220 386 6200 or 00220 232 4242. I will repeat the numbers and I will repeat the address also. 100 Fatu Golden Plaza, Bertie Hardin Highway, KMC. The Gambia calls in WhatsApp or local call, you can say 00220 286 6200 00220 386 6200 or 00220 232 4224. And if you want the number, you cannot find it, you cannot go online, please, my numbers are free. Call me.
Yeah. No, and IGH.gm, our website, our entire store is on everybody's mobile phone, by the way.
Exactly.
So just IGH.gm. And I really challenge people to just, even if it's pain medication for your loved one, just experience the Wellness on Wheels process where you just go online, order a product anywhere in the Gambia. And I'd much rather you say a testimony of what it is than me selling it to you. But everything access-wise is online at IGH.gm. On social media, we're very active on social media. So there's always a way to get in contact with us.
All right, thank you, Doctor. Very soon, as I say, I'm not saying I'm just getting, the floor is so good. I feel like reluctant to finish this interview, but I will finish it. Really, I will not keep you longer than necessary. You say the future is in the hands of the young people. The technological age, technology is the future, which I agree. But yet, in your dad's retirement, he still believes his ilk have the best ideas of what the nation needs. The nation political leadership still teaches between men of his age or slightly younger, still banking on antiquated 1965 ideas to build an effectual 2050 version of our nation, while the talented young and women, especially, languish away on the sideline. Fantastic. What a contradiction, from ageism. Even though the technology is the future, they cannot even operate the mobile, but they think they have the best idea to move the Gambia to next 50 years, next 100 years. This is typical Gambian issue. And the ageism here comes so much so that to the extent the youth take the back seat. Anytime you say, they said, they are our elders, let them handle it, even though they don't have the knowledge, even though they, as you said, the ideas are really antiquated, and then they still think they have all the best idea. That's not progressive. Yeah. Go ahead, Doctor.
No, I think that's a reflection of my dinner table conversation, because for people that know, my dad was 30 years in the civil service. He served all the 3 republics. But the irony about Africa is our forefathers that fought for our independence, every single country, Kwame Nkrumah, Sadao Kairaba, they were young Africans who did it.
Yes.
But yet still, we lose so much talent by constantly trying to use 1965 ideas to solve problems of 2021, as if the Gambia as we know it is not an experiment. The country as we know it is an experiment. And I know it's political, especially in times of election, but people like my father lived in a time where the Gambia as we know it did not exist. It was the Senegambia region. So at what point do we realize that individuals like myself and people who have lived abroad, we've studied in these universities, we've worked in corporate America, we've seen what the standard is. How is it difficult for individuals who see the lens of the future to be giving the table to build the future? Because we're going to live in it. My daughter is going to live in it. Not to say that there's no value in our older population. I think there is. There's a responsibility to allow us with the infrastructure, the knowledge, the institutional memory for us to not try to rinse, repeat the same system and expecting a miracle to happen. Because as we see the world being more and more competitive, sadly, we're being left behind. And we're losing an entire generation of Gambian talent who never had an opportunity to serve the nation. And when I mean service, it's never government. I think that's something we need to get away from. There's not any major successful country that the government made it successful. The United States was built by the private sector. Most places, for you to develop your country doesn't mean you have to be in power. But the ideas that infiltrate, the best ideas, should be what Africa's future should be built on. And that should be irrespective of age. So I think that's where that sentiment comes from, because I do believe that we cannot use 1965 ideas to build a Gambia for 2050, as you said, that is going to be predominantly young people. Countries are passing us by. Gambians remember when it was Vision 2020, we were on the same level as Singapore. Look at Singapore today.
Yeah, definitely.
Right? So I think it's not even ageism, but it's more allow best ideas to move forward to benefit the most people in the Gambia. I think that's the sentiment that I wrote from. But it's always interesting banter because I have a lot of good mentors like my dad and his age mates that are of extreme value to me. But we need an infusion of new ideas.
Hey, we are blessed, and the whole thing started with discussion, and we have to discuss some of these things. They are important, because you make this fantastic write-up, just around 18 February, our independent time, yeah. And it is so important. We have because we should not shy away from discussing some of the things that are affecting our country. And you were casting some doubt, in a nice way, to prick discussion so that we can come to the table and discuss issues, and the moral lessons about this piece. We can do our program on this paper that you wrote, all our program for 2 hours, to dissect some of the burning issues, that you captured in the issue, not, anything political and all those things, even if it's political, we should not shy away from it if that's going to develop our country. So you say, what does it actually mean to be Gambian? And what independence is there to celebrate? What are we free of? You say 56 years later, the independent Gambia's Human Development Index ranks 172 out of 188. 41% of our population live in multi-dimensional poverty. Only 35% of our population are considered skilled labor force, and the average Gambian is only living to be 62 years old. These some of the issues, and you don't have to comment on this, but the next point, that is what is important, and still we have this mentality. The African man was always the accomplice in the story. that his HIS that you are just kind of using a pseudonym and all those things, and you building this right up. I will urge everybody to read this. Getting intoxicated on the two pervasive P's. That's power, possession. And to this day, seeking power by all means necessary, while maintaining the audacity to believe possession of the nation's wealth, the youth's future, and dictating what a woman can or cannot do with her body. And agency is a God-given right. These are very, very relevant. And only this point, we can discuss this point and dissect it, to reflect the reality of the Gambians and the thinking that Gambian men have. Even the youths that are coming with these mentalities. It seems we are not learning anything. Doctor, you have to talk about these things anyway. We will talk about this and we close it. I'm not going to ask anything really, but
I think I still fall in the category of being a man. Granted, I'm younger, but I think Africa's story has always been incomplete. I wouldn't say untrue, but incomplete because of who the narrator has been. And I come from a household, an institution where so much of what I know and what I value, an African woman instilled it in me. But be it religious reasons, be it nation building reasons, so many stories about what kept our communities and our nations together when the narrator was telling it was missing the faces of a woman and the faces of a younger individual. So that's not even a critique, just an observation. And for a nation that is majority women, if we want to be honest with ourselves, Gambian women are outperforming and have been outperforming Gambian men across the board, academically, economically, when it comes to wealth generation, value creation, family sustaining, but yet still most institutions, including decision makers, they're not equally represented, but yet still for religious reasons, we spend more time speaking about their agency than allowing them to be heads at our table. So that's just an observation. And not to be even hypocritical, because we live it at Innovarx. Our company is majority women, not because we go out hiring women, but Gambian women are extremely talented. The African woman story is the most untold story in the world. So it's just a mere observation that throughout history, the glory and the narrative and the power and the positions, the opportunities have always skewed towards an older African man. And if we want to reimagine a future Africa that is democratic, that is meritocratic, it has to be something that is independent of that structure that has held on to power and ideas and influence for a very long time. So that's just more a mere observation, and I'm intentional because so many of my heroes are African women, and it starts with my family. My grandmother, I consider her a giant. My mother is the most astute businesswoman I know, and she never set foot in a college campus, doesn't have a college degree. But I grew up watching her do business in Beijing, in Dubai, doing math in terms of margins. So the businessman I am today is because of her, but her stories is not part of the Gambian narrative. So it's just a mere observation. And I think our society, men of my age, should be comfortable acknowledging the position of privilege we've kept. That way we prevent 35-year-old men like me becoming 79-year-old men who are still trying to rule and dictate the affairs of the nation. So I think it's a mere and honest observation, and it's something that I'm always conscious about it, and I think we should just have dialogue about it and just not keep saying protect our women. No, we should police our men. That's the mentality. Don't protect the women, police the men. And I think that's just encapsulates it.
Yeah, Doctor, your final word. I'm not going to ask anything else. We've been here for 2 hours anyway, and I'm getting carried away. But really, you should write more.
I wasn't expecting you to talk about my writing, because as my wife will say, Adama always tells me the things you write and the person you are in real life sometimes is two different things. but I'm just a curious individual. I've always been curious as a child. I question norms. I don't think as a society we question a lot of things that we're just fed. But notwithstanding, it's still an honor and privilege because I think there's always more to a human being than what they do. And I think even for young people watching it, yes, I'm a pharmacist by profession, but that's not who I am. I'm a father, I'm a husband, I'm an African, right? So I think there's more to a human being than what they do. I even tell people the doctor title means more to my mom and my dad than it does to me because it doesn't define me. And people are still, they have come with flaws. But I appreciate the opportunity to engage with Gunjur. Innovarx is a passion project. It's something that I've given my whole life to in terms of everything that it could be, because I believe that we have to be the Africa that we want to create. And it's high time for Gambia to have a different narrative. But so much of our stories are told by people who are not of here. So even platforms like Gunjur allowing me the opportunity to engage. I hold two different nationalities. I think both the United States and Gambia is a part of who I am for the better. And that's how it should be. Whatever's good, we should extend it. So it's just an honor to be in the Gambia, trying to help people get as healthy as realistically possible. So to the diaspora, we look forward to engaging with you. But I just thank you guys sincerely on behalf of the entire Innovarx Global team, all 50-something of us, for believing in us. And we'll work every single day diligently to make sure we make the entire continent proud.
Thank you, Doctor. Thank you to all our viewers all over the world. Doctor, we've been humbled. It's been an honor for you on behalf of your team to be here to discuss some of the issues that are going to catapult our country to another level, including our health. The majority leader, K. Barrow, is watching you. He said, just joining, come back our session at the ECOWAS Parliament. I just suggest that Dr. come back to talk to the youth. Do impress with his talent on KKB. Wow, fantastic. We have the majority leader watching you here, and he's a keen follower of Gunjur Online. Dr. But really, thank you so much, and thank to our listeners. Your final words, final advice to our people, our young people, or whatever, on IGH or any other thing, and we will just stop it there. Thank you.
Just thank you again, and just God bless all the viewers who are watching. We don't take your trust lightly, so we'll just continue to be better. And I think healthcare should be a right for all, and for long as Innovarx Global is in existence, which we want to be for a very long time, people's health will always be our number one priority, and excellence is something we want to always be intentional about. And for all the Gambian professionals that normally don't get all the credit, I see what you do and you inspire me. But collaboration and not competition is how we would create the Gambia that could compete on the global scale. And I think it's beginning to happen. So the youth should be very excited and energized and be audacious enough to go after what they believe in.
Thank you, Doctor. Thank you. Once again, greetings to everybody. Greetings to Adama and everybody in your company, and Gerard and many things, and Mrs. Kulubali and everybody else. Thank you once again, Doctor.
Thank you.
The days of limited access to quality medications and healthcare services are long gone, with Innovarx Global Health ushering in a new era of healthcare delivery in Africa. IGH now offers an all-inclusive care plan designed to provide a comprehensive management of chronic diseases, such as diabetes, hypertension, and other ailments that require close monitoring and routine medications. Our global clinical team leverages technologies such as point-of-care diagnostics, telemedicine, Agasta cloud-based electronic health record system, and electronic prescription processing of FDA-approved medications to effectively manage patients and produce positive health outcomes. The plan provides a peace of mind to patients in the Gambia and their loved ones who may sponsor from overseas by providing 4 free prescription medications a month, 4 diagnostic tests a year, free Wellness on Wheels delivery from Banjul to Basse, 10% off all products and services, all for a price less than a cup of coffee a day. D, $38,050 a year. Flexible payment options available. Why travel abroad to receive quality healthcare anymore when IGH can bring the quality you deserve to your doorsteps? Sign up today by calling 220-232-4224 or emailing careplans@innovarxglobal.com.